and welcome back. Today I am joined by Kaitlyn Kakar, a pelvic health physical therapist at Thriving Mamas, and we are going to be discussing use of the wand for pregnancy and postpartum management of the pelvic floor. The pelvic wand is a really useful tool for perineal massage, and so Kaitlyn's going to talk a lot about that. And we'll talk about how the wand can be used to help with recovery postpartum, whether you've had a small tear to a large tear of the perineum, or a episiotomy, or you just need it for pelvic floor recovery, even if you had a C-section. The pelvic floor can be impacted by pregnancy and delivery of all different types. So we will be discussing that with Kaitlyn as soon as she logs on here. If you do have questions, please don't hesitate to ask them in the chat, and we will be sure to answer them. You can also always reach out to us at support@intimaterose.com, and we can provide you with answers and help connect you with a pelvic health PT in your area. And Kaitlyn's coming in live from Arizona, so if you are in her area, you can go see her, and she makes amazing content that is really educational and supportive, and she has great exercises. While we're waiting for Kaitlyn, does anyone have any questions for me? Okay. I had other guests on this week too. We discussed men's health on Monday, and we discussed that it's Men's Health Month for the month of June. So please don't hesitate to check the other There she is. Check the other interviews that were live, that were saved to our wall this week. Hi, Kaitlyn. Come on in. There she comes. Hi, Kaitlyn.
Hello.
How are you?
I'm good. How are you?
Good. I was just introducing you and telling everyone about your amazing pregnancy and postpartum content and how we're going to be discussing the wand. So do you want to start by telling everyone about your practice as a pelvic health PT?
Sure, I would. So my name is Dr. Kaitlyn Kakar. I'm a pelvic floor physical therapist, and I specialize just in pregnancy and postpartum. So I have a 4-year-old and a 2-year-old. And after going through my pregnancy, birth, and postpartum with my first, wow, my eyes were open to how much support and resources that moms need during this time of their life. And so that's kind of how I fully jumped into treating pregnancy and postpartum. But I've been a physical therapist for about 10 years, specializing in pelvic health for almost 5. And it's an incredible journey, to say the least. So I started off my practice purely virtual, then went mobile, and now I'm in person in Scottsdale, Arizona. I still do virtual appointments with anybody worldwide, but mainly I'm in the clinic a few days a week, and that's where my passion lies. I just love working with women during this time of their lives, because like I mentioned, I just feel like I wish there was more support, and I wish it was a standard of care that everybody saw a pelvic floor PT during both pregnancy and postpartum. So I'm so excited to jump in and talk about all the things today.
I love it so much. And I will say, you are in the thick of it with a 4 and a 2-year-old. My mantra was, and I still believe this because my kiddos are 10 and almost 8 now, is that if you can get them both over the age of 4, life changes considerably. When people are putting on their own shoes and understand the importance of sunscreen so they're not wriggling away like an alligator.
Yes, exactly. But that's one thing that I love about being in this time, though, is like, I'm going through it too. I'm in the thick of it. I get it. I've gone through a lot of these things. I know our time is precious. So I feel like, being in the thick of it, you feel all the things that these moms are feeling when they're coming in and talking to you about a whole host of issues. That I feel blessed that I get to treat people that are like who I'd want to be friends with. Like they come in and we chat and we help them with their pelvic floor things. But it's just so nice to be able to relate to them on a different level.
Absolutely. I love that too. So you have done some amazing content around the wand. Let's
Yep.
talk first about the pregnancy stage of use of the wand.
Perfect. So I found this tool, honestly, I love this thing. And I love seeing moms' faces when I pull this out of my drawer. They're kind of like, what is she going to do with that? And where is that going to go? But after we talk through it and they use it, they're like, oh my gosh, that was so helpful. Or, oh my gosh, why didn't I do this sooner? Is I just feel like it helps to make what we're going to talk about next, perineal massage, so much easier to do. So probably one of the biggest things that I talk about is perineal massage. So starting that around week 34, 35 of pregnancy. I always remind my patients, talk to your doctor or midwife, your provider, make sure they're okay with it. I have had yet to have a provider who's not okay with you doing perineal massage, but if for some reason you're on some sort of pelvic rest, that would be a reason that I would say not to do it. And I feel like there's a lot of mixed opinions, mixed information about perineal massage. So as I'm going through it, I'm coming from, my personal experience, the education that I have, why I think it's important, the results that I have seen with my patients as well. But ultimately, it's up to that person if that's something that they want to do and if they would find that helpful. So there's good research to support that it helps to decrease those grade 3 and 4 or more severe perineal tears. So grading goes from 1 to 4, 4 being the most severe, 1 being the least severe. So in my mind, if we can do something like this to decrease those grade 3 and 4 severe tears, let's give it a try. Let's do it, right? So the other thing that I like to mention is when we're doing this massage, the goal is not to stretch those muscles as far as we need to get the baby out, okay? It's more so to prep the tissues. So I like to give the example, like if you are gonna go run a race, we're gonna wanna warm up those muscles, get the blood flowing. We might do a few dynamic stretches so you are ready for the race. Kind of similarly for birth, we want to prepare, and I have my pelvic floor model that we'll use here too. We want to prepare these muscles that are at the bottom of the pelvis for that vaginal delivery. And again, one of the ways that we can do that is with perineal massage. So helping to improve the mobility of those tissues is part of it. The other part, which I think can be sometimes even more important, is more of the mental component of connecting our brain to these muscles. So majority of the patients I see are just learning what a pelvic floor is and what their role is. They might have heard about Kegels and tried to do them, but we still need to spend a good amount of time reviewing what are the muscles, where they are, what they do, what it feels like to turn them on. And then for birth, the more important part is how to relax those muscles, how to lengthen those. And so I would say most of the moms that I see, there is some degree of tension in those muscles. So we need to spend a good amount of our time teaching those muscles how to relax and how to let go. And I feel that perineal massage is a wonderful way to start feeling the sensations of when there is some stretch placed on these muscles. I want to try to continue to relax and I want to breathe so that when I am pushing, I can start to remember some of those sensations of letting those things go, to breathe, to be able to fully relax. So I like to give that little recap at the beginning of this is why I'd recommend doing it, but then it's completely up to you. So let's talk about how to do it, okay? So if we look at the bottom of our pelvis, the area that we're specifically going to be working on is the perineum, which is that space between the vaginal opening and the anal opening. So I like to think it's more so the bottom half of that vaginal opening is where we're going to be working. So with the wand, which again, it just makes this so much easier to do, to be able to reach around that bump, to be able to get to this spot. If you're doing it in the shower or the bath, which is a great place to do it, you might not need lube. If you're not in one of those locations, I generally recommend putting some lube on the tip just for ease of comfort. When we start this, I like to say, just start small. So your goal is to just insert maybe to that first little mark there and see how it feels, okay? So that would look like you're gonna take your wand, Put that right in the center there, okay? As we're doing these things, we want to take those nice deep breaths, full inhales, full exhales, trying to feel a softening or a letting go down in that area. Then we're going to take the wand and we're going to gently press downward. Now, this pressing downward, I like to say you're almost checking that sensation of how ripe is an avocado? I'm not pulling, I'm just gently assessing and pressing fairly light at first. So just a gentle pressure. I like to hold that for 5 to 10 breaths. And what you might feel when you first start to press is it could feel like stretching, it could feel like burning, it might feel a little uncomfortable, but I don't want so much pressure that it starts to feel like pain. I like to stay away from pain, but stretching sensation is what we're going for, okay? So that would be the first spot that I like to recommend going. Then we go at an angle, we repeat those same breaths. Going to the side, repeat the same thing, and then you'll follow that up with the same thing on the other side. If that all feels good and you feel like you can do a little bit more, okay, then we can go a little bit further into the wand, which will help get a little bit of those deeper muscles. And what most of my patients will find is that either that initially where those muscles are, that feels the tightest. And then once they get a little deeper, that all feels okay. So then I would say focus more on those superficial muscles. It sounds like those are probably the ones that we're going to want to address more frequently. And as far as how often do I need to do this, how long do I need to do this for, I find a few times a week is great. 3 to 5 minutes at the most. It does not need to be a long, drawn out thing, but doing it semi-consistently can be really, really helpful. For the moms that are a little bit more hesitant, I like to say, try it once and see how it feels. If you do it and everything feels pretty good, I felt a little stretch, I don't feel any burning, I don't feel any discomfort, it felt fine, then I'd say that might not be a priority for you. Those muscles might have a good amount of mobility. For those moms who are like, that did not feel good, it was very uncomfortable, then those would be the people that I'd say, okay, let's do a little bit more frequently so we can prep those muscles even further. Your body might benefit from that a little bit further.
That's so that's so important to note that if that sensory experience is ouch, the tissues are asking for more experience
Yep.
with it, more patient.
Exactly. And it's been really cool. Like I do birth prep appointments around that 34, 35 week appointment. We go over perineal massage. We'll go over different breathing techniques, different pushing techniques, other ways that we can help relax your pelvic floor. And then it's so cool to see the moms postpartum being able to remember some of these cues and things that we've talked about, or, oh my gosh, I only had, a grade 1 tear. I didn't have any tearing. Like, it's so exciting to be on the other side of things, to be like, these tools really do help moms. And I feel like just having that knowledge and being empowered of, I can take these steps to hopefully have a more positive birth. Oh, it just makes my day. I love being able to share those things with these moms.
I love it. And I love your enthusiasm. And that makes for such a welcoming environment for people that are it's vulnerable, even if they're like healthy and thriving great and having a non-complicated pregnancy, they still need that comfort.
Yeah.
We will segue and talk about postpartum. There was a question that came up that I want to answer before we do that. And it's that question was, can you use the wand for other pelvic health issues, not just pregnancy? And the answer is absolutely yes. The wand is designed to help anyone with pelvic floor muscle dysfunction where they need to provide myofascial release, tender point release, mobility, to draw attention to the area, to bring blood flow to the area. The wand is for that, and either end can be used rectally or vaginally to help address pelvic floor dysfunction in the non-pregnant population, and that's something that we treat all the time in the pelvic therapy space. All right, do you want to talk about postpartum now?
Let's do it. So postpartum, if we do have some perineal tears, and I like to mention, almost 80% of women will have some degree of tearing during postpartum. So we can do everything right. We can do all the prep. We can do all of the things. Sometimes we have tearing. It happens. That doesn't mean you did anything wrong. That's just how your baby had to come into the world. the good news is there's things that we can do to help that tearing spot heal maximally and function properly. Okay. And one of those things is to be able to address any scar tissue that has formed. So if we think again back to the perineum, the perineal tears generally are occurring in that area. You can have tearing anywhere around that vaginal opening, okay? So oftentimes when our bodies are healing, the way that they do that is they tighten. We're trying to protect, we are trying to heal these tissues. So I tend to find with my patients that even postpartum, just because something came out, just because the baby came out, that doesn't necessarily mean things are going to easily go back in. Sometimes we still need to address tension and tightness in these muscles, no matter how you gave birth. So even if you had a cesarean birth, you might still have some tension in these muscles that could be contributing to pain with sex and things like that. So specifically back to those perineal tears, we can use that wand to help with the scar tissue. First, just even starting externally, placing the tip of the incision where that scar is. And a lot of times most moms will know exactly where that spot is. They'll either have some sensations down there that are uncomfortable, they've returned to intercourse and they're like, I know it's exactly on my left-hand side, right where it is. Some people might not know exactly where it is, but that's where an internal exam will give them good indication of, okay, this is approximately where you can see that incision and that scar. But using this right on the outside to start, just even making little circles over that area, we kind of need to desensitize that spot. And a lot of times when we go to touch that area, our brain will be perceiving that spot, that gentle touch, as alarm bells. Like, oh my gosh, what is touching this? I feel a very intense sensation, which if I touch another area that hasn't been affected, our body's like, oh, it's just like someone's touching my shoulder. So we still want that spot where the tear was to have the same response of, oh, this is just what light touch feels like. This is what it feels like to touch my shoulder. And by desensitizing that area, either one, using your finger and light touch, or using the wand, it can help our brain to now start perceiving when something touches this area, I don't need the alarm bells to go off. It is just that light touch that is feeling it. So I always say start externally, do some gentle massages, then we can start to work internally, doing kind of similar to the work that we were doing with that perineal massage, going at different angles, going at different depths, trying to get that tissue to move really, really well again. So I love the wand for patients to be able to do things at home on their own. But if you're sitting there and you're like, there's no way I can do that, that's where you come in to see a pelvic floor PT. We get to help you. We get to walk you through step by step what that looks like. We can start that process of desensitizing the tissue, getting things moving. Then when you feel like you're ready to start doing things on your own, that is where the wand comes in. And honestly, I think there's sometimes a lot of fear, nervousness around using one of these tools. But again, I can't tell you, I've had so many moms that are like, oh, I wish I would have done that sooner. That was great. That was so helpful. Even in just 1 or 2 times using it, it can make a massive difference. So if you're nervous or if you're on the fence about it, start small. We're gently working through those sensations that what we might be feeling. And of course, always reaching out to a pelvic floor PT if you feel like you need a little bit more guidance. And I know on your website, your Instagram has so many wonderful tutorial videos of how you recommend using the wand. And I've had patients who've gone through all of them and they're like, it was extremely helpful that, you know, we verbally talked about it and then being able to see those visuals is very, very helpful.
Thank you so much. That means the world to me that I get to help everyone else's patients.
Yes. It's a collaborative approach
That's
here.
exactly right. And one of my other most favorite features of yours is your exercise prescription. You have such lovely exercises and you explain them so well, and you use exercise prescription a lot in the recovery process in addition to comprehensive plan of care. Do you want to talk about some of your favorite go-tos and crowd pleasers?
I would love to. So I find that exercise, movement, stretching, mobility is key during pregnancy and postpartum. Our bodies go through so many massive changes. And when we're pregnant, we see these physical changes happening. Our belly starts to grow. We might notice that our center of gravity is shifting, or kind of where we hold our weight is different. Our shoulders might round forward. It's a very visual thing that's happening, and we are seeing these changes. And that is muscle changes are happening, postural changes are happening that can sometimes lead to aches and pains, back pain, hip pain, side joint pain, pubic bone pain. But one of the biggest things that I feel like helps to hopefully prevent those things or treat those things is oftentimes targeted stretches and strengthening exercises. It always makes me sad when I see moms who become pregnant and they're like, I'm scared to exercise. I don't know what to do, so I just didn't do anything. If you have been exercising and moving your body, I would encourage you to continue doing that. Our bodies crave movement. They need stability. Most people have heard of that relaxin hormones that make the ligaments a little bit more mobile to be able to help get your baby out. But that means that our muscles that surround those joints need to work even harder. We need more strength. We need more stability so that we're not creating pain in those areas. And this is where exercise comes in. And there's so many wonderful resources out now by personal trainers who have a specialty in pregnancy and postpartum, other pelvic floor PTs that have really good programs. So if you don't know what to do, seek help from those people. See what your body needs that might be different than somebody else's, but continue to exercise. So let's get specific here. What are some things that I would say definitely recommend? So key areas that we want to target are our abdominal muscles. So remember, those abdominal muscles need to stretch to allow baby to continue to grow. We can still strengthen those muscles. It might look different than what you're used to. So we might not be doing sit-ups and crunches and planks, but we need to be able to turn those muscles on to provide our pelvis with really good stability. So one simple exercise that I like to recommend, and I'm going to bring my screen down just a little bit so you can see where my belly is even just placing your hands on your belly, taking a nice inhale, and as you exhale, trying to hug that belly up and in, and you'll feel that belly bump moving just a little bit, and it'll come up and in. That's how you're going to know that you're targeting those deepest core muscles. That could be an exercise. Inhaling and relaxing, exhaling and lifting the belly bump up and in. And I can tell you that's sometimes hard to do. A lot of times we're used to turning on our upper abdominal muscles, but to get those lowers to turn on, that's hard. So we can practice that in sitting. We can practice that in hands and knees. We can do something like a bird dog, doing an opposite arm, opposite leg exercise. I love core work that keeps our core relatively in a neutral position, but we could maybe use our arms and use a band and doing some rotation, or pulling that band down or pulling that band up. Still focusing though on trying to hug that baby bump up and in. The glutes. The glutes are key. Remember, these are those big muscles that help propel us forward when we're walking, and they also help to stabilize the pelvis. So we can do things like glute bridges. If laying on your back isn't comfortable, you can lay on a bench and do more of hip thrusts are really great. Side stepping with a band around your legs, doing little monster walks can be great. Even something as simple as laying on your side, doing some leg lifts to keep those glutes active is fantastic, okay? So core, hips, two really key areas to make sure we get the stability. From a mobility perspective, our upper back, our thoracic spine, we need to have rotation. So as the bump is growing, breast tissue is growing, everything starts to come more forward, which can lead to some neck pain, upper back pain, lower back pain. Continuing to rotate through that upper back is wonderful. So this could be as simple as I'm laying down on my side, my knees are stacked, my hips are stacked, and I am rotating my upper body open. You'll feel some pec stretch, you'll feel some upper back stretching. And then also our hips moving. We need to be able to move those hips side to side or through internal and external rotation. Even sitting on the floor with your hands behind you, bending those knees and just letting those knees go in and out like a windshield wiper, that will help keep a great amount of mobility. Cat and cow is good for spinal mobility. Child's pose is great. Honestly, I could give you a million exercises, but we'll keep it as those as kind of a starting point of things that you want to make sure that you're targeting. And if you're following another program, that's great. These might be things that you kind of intersperse as you feel like necessary. If you're like, oh my gosh, my upper back is so tight and stiff, add in some of those open books. Or if your hips are feeling really stiff and tight, add in some of those windshield wipers back and forth to keep your body feeling good. Now, as we switch into the postpartum side of things, which I love talking about this, we all need some degree of rehab in the postpartum phase. I have yet to have a mom who I have seen postpartum who perfectly knows how to breathe, perfectly knows how to turn on their abs, or turning their pelvic floor on exactly the way that we needed to, myself included, other pelvic floor PTs. We also need rehab. Like I mentioned, these muscles do go through so much change through pregnancy. Then we have birth on top of it that we unfortunately can't just jump back into what we were doing beforehand. We need to have a step-by-step approach to get back into exercise. I want you to get back to things as soon as you want to get back to things, but I want to make sure that we're doing it in a way that's creating success and not setting us up for failure. So what does this look like? In the first 6 weeks, there are movements that we can start doing, and it's not going to look like typical exercises. It's going to be, let's start with some breathing. Let's get your ribs moving. Let's make sure your diaphragm is moving, feeling that breath moving side to side, feeling that breath going down towards the pelvic floor as opposed to up into the shoulders. So this could look like laying in bed, keeping your knees bent, putting your hands around your rib cage, again, taking those nice deep breaths. You can do this day one postpartum if you feel like, I need to move my body, I need to do something. This is a great place to start. Not only helps getting your diaphragm moving, but it also helps to calm your nervous system. A lot of times as new moms, there's a lot going on. We have to keep this baby alive. We're trying to figure out nursing, how to feed our baby. There's lots of things. We all could use some calming breaths in these first few weeks. So even doing some breathing can be really, really helpful. The other thing that we can do, we talked about those little baby hugs when you're pregnant. Kind of similarly on the postpartum side of things, we want to get those abdominal muscles turning on again. So it can be very gentle, very light. If you put your hands down by where your hip bones are, on your exhale, trying to feel those two hip bones coming together. Almost like you're wrapping a corset together, trying to feel those muscles turning on. And in those first few weeks, you might try to tell those muscles to turn on. You might not feel anything happening. That is okay. Lots of things are trying to get reconfigured. We're just trying to get our brain to reconnect to these muscles that have just been stretched. Now there's not a baby in there anymore. They're trying to figure out how to turn on again. So this is where that mind, body, brain, body connection comes into place, that we kind of need to get everything back logged on again. We need to get the brain reconnected to our diaphragm, our brain reconnected to our abs, and our brain reconnected to our pelvic floor. And for our pelvic floor, this might look like doing some really gentle Kegels. And I feel like a lot of times people aren't doing Kegels correctly. So when I'm talking about doing a Kegel, we want to feel on our inhale, breath going all the way down, ideally down to the pelvic floor muscles. And we want to feel that these muscles are relaxed. In early postpartum, most people will feel some degree of relaxation. If you're breathing down and you feel like everything is going down and there's a lot of pressure going down, then maybe going down isn't the best breath for you. Maybe you want to think of more rib expansion, getting that pressure dispersed in another way versus all that pressure going down. So it can be a little bit individualized based on what you're feeling when you do this. And then when you go to Kegel or lift those muscles up and in, the cue that I love the best is imagine that you're pulling a blueberry up and into your vagina. You're going to squeeze gently, okay? Squeeze those muscles and lift up and in. And similarly, your brain might be trying to tell those muscles to squeeze. You might not feel any squeezing. That is okay. Day upon day, as we continue to practice that gentle lift, you're going to start feeling things turning on. This does not mean we're doing a million Kegels, okay? This means we're maybe trying 10. Remember, we are reconnecting. We're not strengthening. We're just making sure that our brain can feel what it feels like for those muscles to turn on and what it feels like for those muscles to let go. So those are things that I like to work on in that first 6 weeks time frame, getting all those pieces and parts back online. And then as we progress, getting further and further along, then we can make things a little bit more challenging. We can still do exercises laying down in bed. Maybe that looks like some pelvic tilts, some gentle bridges. Maybe we start doing some core marches. None of these things should be painful, but we should feel muscles turning on. We should feel things working without pain, without uncomfortable pulling. But if we think about the day-to-day things that we're doing in the first 6 weeks, taking our baby to appointments, lifting up the car seat, maybe we have a toddler, we need our core to be turning on. So I would not recommend waiting until 6 weeks and not doing anything. Our body needs some movement, some activation to be able to support us, to be able to do all those other things that we need to do in mom life, right?
Yeah, it's like a whole different sport.
Exactly. Exactly.
The baby and taking the baby out of the crib is like
exactly. And nobody teaches us how to do those things. Like, how should I pick up my baby? How should I pick up my car seat? How should I hold my car seat? Where should my wrists be? We don't think about those things until we have wrist pain or until we have neck pain. I wish there could be like a postpartum prep course of mom mechanics of how we should move to be able to prevent these aches and pains. But a lot of times we don't realize how important that is until we're in the thick of it and we're like, my wrist is killing me. I can barely hold on to my baby. Come see somebody, get help with that, of course. But then share with your mom friends and tell them how important it is to be able to see providers even before you have your baby so that you can hopefully prevent a lot of these aches and pains that we see postpartum.
absolutely. And seeing a provider one-on-one is really important to make sure that your individual unique goals are met. But Kaitlyn, I'm pretty sure that this pregnancy and postpartum course should be added to your list of things to do.
It might be on it.
Ooh, I can't wait.
If only we had more hours in the day, right? Like, there's so many things that you want to be able to do, and I think there's so many ways that we can continue to help moms. I need more hours. I need more hours in the day.
I hear you 100%. Little by little, a little becomes a lot. So you just
exactly
chapter at a time. If it's a book, one component at a time. If you're filming around, and you'll have the whole darn thing will be done.
Exactly. It's so true.
The Blueberry Q to lift is my top favorite. It's really visual and tactile. So many people can have that. And I love what you say about plugging back in or going back online, because people get visual with like, your internet's out. There's no communication between your device and the output there. So plugging back in, and it is neural, and it's neural and muscles and fascia and blood vessels and all of these things.
Totally. And I just wish, I think if more moms understood that, then they would have realistic expectations when they do go back to exercise. Because so many moms are frustrated when they're at 6 weeks and they're like, why is everything so hard? Why is 10 squats seem like a million squats? Like, why is everything so much harder? It's like, we understand as PTs physiologically what is going on with your body, so it makes sense why you feel that way. But to the average mom, especially moms who are super active, the athletes, they're like, okay, I took 6 weeks off. Why is things still so hard? I worked out through my whole pregnancy. I did everything that I needed to do. It's hard for everybody. Everybody has these struggles postpartum of reconnecting, getting things strong. It's frustrating. It is. I get it. I've been there. I totally understand that. But I think being able to work with somebody to make sure that you are taking the steps that you need to so you are efficiently and effectively getting to where you need to be is a game changer. I don't want you following a program for 6 months, not seeing any progress, putting in the time and effort, all to realize, oh, my lower abs were never turning on when I did those exercises. So start seeing somebody first, learn the basics, then do whatever program that you would like to follow. So trying it to do it in that way, again, it's going to save you money and frustration in the long run.
Absolutely. I couldn't agree more.
We could chat about this for days, I know.
Exactly right. Well, Kaitlyn, where can people locate you physically and virtually?
Yep. So I'm located in Scottsdale, Arizona. So for any of you local to Arizona, that's where you can find me. I offer my pelvic floor physical therapy services there. And for anybody worldwide in other states, I do offer virtual consultations. So it's not physical therapy services, but still I'll be able to give you a lot of really good resources. I think there is so many wonderful things that we can now do virtually. I can assess a lot of things just by watching you move, by watching you breathe, seeing things to turn on. I also feel like it's kind of a non-threatening way that a lot of people are nervous about pelvic floor PT. Are you just going to be treating my pelvic floor? So virtual can kind of be a nice way in. And then if we do need some internal work, okay, then come in to see me, or let me help you find someone in your area if that's what you need. But there is so much that we can do virtually. So taking advantage of those services are wonderful. And then you have my Instagram. That's probably where I'm most active on social media, is Instagram. My website is the same, thrivingmamas.com. I have some blog posts up there. I have a quick little 4-week workout guide for both pregnancy and postpartum if you're looking for just some basics to get you started as well. But my DMs are always open. I love connecting with people there, asking your questions. I would 100% rather you DM me a question than Google something. Google can be kind of a scary place, especially when it comes to pelvic floor conditions or pregnancy and postpartum. So please just ask me your questions. I will happily answer them or direct you in the right spot with other information.
That is such a tremendous gift. I appreciate everything that you do because your educational content is so solid and so comprehensive and safe. So
Thank you.
That's a tremendous service that you're providing. And thank you so much for sharing your knowledge and your time with us this morning. I really appreciate you.
Yes, thank you so much for having me. I appreciate it.
Great. And we will see you very soon because I will be coming to Scottsdale August 17th and 18th for a conference. So
perfect. Oh my gosh, I'd love to grab coffee.
Yes, let's do it.
Okay, awesome. We'll set that up.
All right. Have a great rest of your day.
Thank you so much. Bye.